So we are discussing the cavernous sinus. Cavernous sinus is situated on both sides of sella turcica. You can see here, sella turcica has the pituitary gland and the sphenoidal air sinuses. On both sides is cavernous sinus. You can see in the lateral wall of cavernous sinus is cranial nerve 3, 4 and ophthalmic and maxillary. Mandibular is not there. And on the medial wall is internal carotid artery and the 6th cranial. Now the relations of the cavernous sinus: anteriorly is the superior orbital fissure, posteriorly is the apex of temporal bone, laterally is uncus, medially is sella turcica, superiorly is the ophthalmic nerve and inferiorly is foramen lacerum. These are in cavernous sinus, there are tributaries, there are draining channels and there are communication, 3 types of connections. The tributaries are superior ophthalmic vein, also connected with supraorbital vein, central vein of retina, inferior ophthalmic vein, which is also connected to deep facial vein. That's how dangerous area of face is draining into cavernous sinus. There is spinocerebral sinus, there is superior superficial middle cerebral vein and inferior cerebral veins. Many are there. They all drain into cavernous sinus. So arrow is like this. Draining channels are 2. Superior petrosal sinus, which connects it with transverse sinus, inferior petrosal sinus, which connects it with the internal jugular vein. So this is the jugular foramen, and then it is connected to the pterygoid plexus via 3 emissary veins passing through foramen lacerum, foramen ovale, and emissary sphenoidal foramen. These are 2-way communications. These are 1-way towards the cavernous sinus, and these are 2-way. This is 1-way away from the cavernous sinus, and these are the 2-way communications. But these are also most of the time are draining channels only. This is how the fresh blood comes in when we yawn from there. Comparatively fresh blood. Okay. Applied anatomy of cavernous sinus 2. 1. From the dangerous area of face, the facial vein connected to deep facial vein draining into pterygoid plexus. So infection comes from facial vein, deep facial vein, pterygoid plexus and cavernous sinus, or facial vein, deep facial vein, inferior ophthalmic vein and cavernous sinus, or supraorbital vein, superior ophthalmic vein and cavernous sinus. 3 ways by which the infection goes. Cavernous sinus, once infected, thrombosed. When it gets thrombosed, 2 effects. 1 is exophthalmos, because the veins draining the eyeball, superior ophthalmic vein, inferior ophthalmic vein, cannot drain, so now the eye becomes swollen. Exophthalmos, it comes out, pops out. And the nerves supplying the eyeball are, now there is pressure on them, the 3, 4 and 6, so eyeball movement stops, that is ophthalmoplegia. Another applied anatomy where severe head injury, internal carotid artery bursts inside the cavernous sinus, and that time there is pressure. Again, because of this pressure, these veins are not able to drain. There is exophthalmos, ophthalmoplegia. But this exophthalmos is different because of the pressure of the internal carotid artery is so severe that the eyeball pulsates, and this is called as pulsating exophthalmos. So in your internship, such case comes, you don't have to see pulse via putting your hand on the radial artery. You have to just look at the eye. Poor patient suffering from pulsating exophthalmos, and intern is happy कि भैया otherwise वो pulse नहीं मिलता है. You know, internship ना, half of your life goes looking at for pulse and veins for draining